Thank you very much, uh, ladies and gentlemen of the press. We welcome you here and extend again for the second time our apology for the lapse in time. This was certainly due to a series of meetings that we've been having internally and in collaboration with the Ministry of Health, all aimed at addressing some pressing public health and healthcare issues in the country. As you will note, a little over 2 weeks ago, the WHO and the Africa CDC declared monkeypox as a health situation of international concern that ignited every other country to begin setting in motion their preparedness and response mechanisms. In Liberia, far before that was declared, we had a few cases in the last 5 months or so, a few cases of monkeypox detected in this country. As we indicated during our last NPHIL press briefings, monkeypox has been detected in Liberia since the 1970s. There have been intermittent detections and outbreaks around the world. Now this time, it presents a situation whereby it has claimed global attention. Currently, there are a lot of cases in the Democratic Republic of Congo and many other countries in East Africa, including Rwanda, Burundi, Kenya, and Uganda. In West Africa, in our own region, we have Nigeria having most of the cases, and then followed by the Ivory Coast recently, where there have been detection of cases in Ghana as well. Our immediate concern has to do with our neighboring countries in our region. Not only that, but also Far East because of travel between our country and countries within the eastern part of the continent. So you will note that we have a lot of students in Rwanda. There's a huge movement of people between Democratic Republic of Congo and Rwanda. There's a lot of trade and family, personal movements between Liberia and Nigeria. And of course, we share border with the Ivory Coast. This creates a concern for us, given our experience whereby we were not, or were caught unaware with the Ebola outbreak in 2014. During the COVID pandemic, we were a little relaxed. We thought this time around, our country should play an urgently proactive role. And so the National Public Health Institute, with its fiduciary duties, have been acting in order to protect the public, both citizens and other nationals within our borders, and interacting with regional bodies and our countries and partners within our country. So with this declaration, as we reported some time ago, we want to deal just with the last 5-6 months. Liberia had 6 cases. Those were cases that were detected before this international declaration was made. And we want to repeat that. These cases were detected before the international declarations were made, both by the WHO and the Africa CDC. Now, in the last 4 days, within the last 4 days, you may have heard media reports about an outbreak, quote-unquote outbreak. And this created a lot of confusion. What we had done before then with the international declaration was, as we said earlier, to set in motion, activate our response system that includes surveillance. We don't want to own you with, EO this, those nomenclatures are for ourselves, so we'll be very general with you. In general, we set in motion our surveillance and monitoring mechanisms as well as our response mechanism. And these entities within our operation are very dynamic. You can find them in the counties, you can find them at the district level, and they are controlled from the national level at the National Public Health Institute of Liberia. What we did initially was to immediately engage the National Port Authorities in order to assess our response capabilities there. We then went to RIA to do similar work. We also had on our schedule to go to other border points, entry points, where we have health officers stationed. That includes the Bowater side, Springfield, Logatua in Nimba, and the Nimba crossing, the Ganta crossing into Guinea, and many others along the borders with the African coast. With the utilization of time and logistics, we do intend also to look at the border crossing in Toll Town in Grand Jita, to look at border crossings in River G, as well as Maryland. So all of these activities are in line for us to undertake. In the meanwhile, when there was this information about the quote-unquote outbreak of monkeypox in Sino, we immediately jumped to assessing the situation from the national level, contacting the county health officers and all of the epidemiological surveillance group that we have in the county and in the surrounding counties. These have been activated earlier on, put on alert mode, just as national itself was on an alert mode. And we analyzed the information and saw that the information was inaccurate because one, they reported that there were 5 confirmed cases, which was not correct, which was not true. Our county health officers and epidemiological surveillance team never ever gave such report to any reporter. So that report by the media then was false, erroneous, and incorrect. We want to make that particular declaration or that particular statement. One thing that we will ask the press to really understand is the fact that there are terminologies that we need to sometimes explain to you. We may not drill you through school, classroom 101 epidemiology or public health, but we think when you understand these terminologies, it will help you as well. There are resources available all around to also help us to understand these terminologies in particular situations. And that is why health reporting, public health reporting, medical technology reporting will be very important for those of you who come or who follow the NPHIL, who follow the Ministry of Health, who follow the EPA, the Forestry Development Authority, because we are all interagency collaborators. Those who follow the WHO, for example, will understand these terminologies. There's a difference between a confirmed case and a suspected case. So when you talk about a case, that's a case. Then you qualify the case as being suspected or confirmed, depending on what you do to that case, or depending on the information gathered out of that case. So we will ask that people be very careful with them. When in this situation of monkeypox, for example, where the symptoms are inward and outward, we look at both types of symptoms. Fever, the outward, we just deal with just one symptom. Rash, and what in medicine we call vesicular papules, those bumps that you see with the pores in them. They are concentrated in the palms as well, and that distinguishes it from smallpox. There will be many other pox diseases that you will hear about. There's cowpox, there's chickenpox, there's monkeypox. There are many poxes we hear about. They're all from the same, more or less, family of viruses. And so you have to be very, very careful with that. So that would be a distinguishing outward feature. So then you suspect in that case. That is a case. As you see it, that is a case. So once you see those symptoms with the temperature, high temperature, body temperature, that's a suspected case. You suspect them with the picture we have and all of that. You suspect that, this person could be having some kind of pox. Okay? You're not immediately going to even say it's monkeypox. Now we take the samples, whether from the blood or from the skin lesions, you know, those blisters and those bumps, the liquid that is in there. There you find most of the time the virus is concentrated in there. So we take that and take it to the laboratory. When our laboratory results tells us that this is it, you know, then we come back and say, this case that we saw, this case that we suspected, this case is confirmed. So you see how it goes. So we don't just see a case and then just go and say, it's a confirmed case, it's an active case. Then we come to active cases. Once that is confirmed and we see those outward clinical pictures and inward symptoms, that case becomes an active case because we now confirm it in the laboratory as positive. So we have to then isolate that case, meaning take that person away, put them somewhere in a closed area or room at a hospital or at an isolation unit. I know all of us here are familiar now with isolation units, and we went through Ebola, COVID. So then that person is isolated, they are put aside so that they don't infect the other people. So doctors will go in there to begin to treat this person. And these doctors go in with down in the necessary protective gears so that they don't come back outside with the virus or with the sickness and then transfer it to somebody else. So we are very careful about that. What in medicine we call nosocomial transmission. Then it starts to go back in the community again. So we deal with all of those things very technically, and we really want you to understand, just from this simple explanation, the difference in these terminologies. So that case now becomes an active case. We treat it until that person gets well. Then it's no longer an active case. So on our statistics, we remove that on the active case block. So that's how we define these simple terminologies that are sometimes confused by people. We hope you will take a lesson from here, and we also really hope to learn from you as well. Because in your own profession as journalists, the terminologies that you use, sometimes when you ask us questions, we have to think 2 times before we answer you so that we don't give you the wrong answer. So that's about it. Going further, what we have learned in the last 24 to 72 hours is that those 5 that were reported were all negative. None of them were positive. So for us, those remain suspected cases. And those cases cannot be counted among anything that you can call an outbreak or whatever they may have termed it that we reacted to. Now, in the last 24 hours, there were samples sent from Sino County. They suspected 8 cases. They made follow-up, meaning contact tracing, those who came in contact with any of these 8 persons. Now, there's 1 person who may have been the patient 0 or suspect 0. And from that point, the family members are taking care of this person because they show all the symptoms. This is just for your biodata, and there will be no name called to respect the HIPAA regulations. This is a 7-year-old female, have no travel history, never traveled from Sino, and this place is located in one of the deeper part of Sino called Jidepo. The very district, the very area is the Dodwoken, is in Dodwoken. So those of you who are from that area, you can imagine the terrain we are talking about. There are large rivers in that area, so accessing the patients and the suspects is very, very difficult. Now, out of those 8 cases, we had 2 samples that were carried through our testing regimen. 1 of those came out positive. So within the scope of the declaration of this outbreak as a disease or health situation of international concern, we can say that is our first case within this period. That's our first official case since that declaration was made by the WHO and the Africa CDC. Both the Ministry of Health and NPHIL authorities were at 2 different conferences recently, just around the same time. The Minister of Health, Dr. Louis Poto, led her team, and because of the time factor, I went to represent the NPHIL in Congo, DRC, while she and the other team were in Congo, Brazzaville. And all these health matters were discussed. Liberia's report was that we were in the process of activating all of our national system because we have already done it at the sub-regional level. And our presentation, both in Brazzaville and in Kinshasa, were models suggested that gave the impetus for other countries to begin to follow, that Liberia was being very proactive, drawing experience from past events, past situations in terms of outbreak and pandemic, Ebola and COVID to be specific. Now, what has happened is that given this definition, we have 1 case. That case is active. That case is confirmed. That case is being managed, meaning they've been treated. And now our surveillance group are following up on whatever person or whoever that case may have come in contact with. Almost immediately we know that this case came in contact, which is obvious, with the parents and some relatives. In our African setting, once the child is sick, everybody will want to come and do whatever they can. If the mother is doing something else, the auntie will come to take care. So these are the immediate contacts that we are following. Information from the county health team led by Dr. John indicated during our discussion today that the mother is showing symptoms of monkeypox infection. So for us, that will be a suspected case. Once we get the samples from that patient and test it, and it comes out positive, that will become an active case. To this present time, that is a suspected case. There are three to four other family members that are in very close contact within the same house that we are following. Besides that, we are following multiple number of people as well who may have come in contact with this case and these contacts that they have come in contact with. Because the contacting is a chain. You know, I come in contact with you, you come in contact with somebody, and that's how the virus is spread. So that chain is what we are tracing. Samples were collected, and some of those that were only showing fever, samples were taken from them. By samples we mean blood was extracted from them, and for some of them, the skin scrapings and fluid from the rashes were also taken. Those who were showing early symptoms, what the team in Sino did was to gather, to extract blood samples from them because they had not started showing outward symptoms. So the only thing they could extract was blood. Now, because of the difficulties in accessing that area, they may not be able to immediately go back. But from the telephone contacts, they will follow up with them to evaluate as to whether they have come down with full-blown monkeypox infection. Now, it's not to say that they will not go back. They're coming back to bring more samples that we will be testing. In that regard, we're doing everything possible, given the list of logistics that they need, to begin to supply them with the logistics, gloves, a ready ambulance that will go at least half of the way, because the car takes them a certain distance, it cannot go any further, they have to get on back to go, and they get at the river, they cannot cross, so they have to cross with canoe, and then continue from the other side. And that's how difficult it is, for which we must appreciate the level of work that these folks are putting into helping to save all of us. Once we are able to identify those and stop them in the track, it will not go over to River G, it will not go over to Maryland, it will not go over to Grand Cru, it will not go over to Bassa, it will not go over to Nimba, because these are the surrounding bordering counties of Sino. So that's the technique that we are applying. All the things these baby boat people learn over the years, that's what they are applying now. So you should rest assured that the National Public Health Institute and the Ministry of Health are on top of this. We have been very, very proactive. We are going ahead of ourselves so that we are not caught unaware. At least at this time in point, during COVID or Ebola, we were just scrambling around and asking for outside help. But now we're able to start to work ourselves, to respond and ask for additional material and equipment so that we can address what is currently on hand. In this respect, we do, in consultation with the Ministry of Health, want to announce to you the formation of the incident management system. So it is that system which now nationwide will coordinate all other responses in the various counties and the districts. So that is the immediate second step, since initially we have already announced that we knew of this virus. We have announced that we were visiting the ports of entry or points of entry. We have announced that our district and county officers in terms of medical care and surveillance and monitoring were already alerted, and they have already started working. As you can see, you can see some of the results that we are getting now, that we are not sitting supinely. So we want to give our thanks to the Sino County team led by the health and public health leadership there for such a brilliant work, for such excellent work under these difficult circumstances. It's not like places that bump that you can just ride a car to go to Swakoko and come right back. These are very difficult terrain, those of you who've been in that area. So we do, at this point, announce the formation of the incident management system nationally. It is that system that will now nationally coordinate the response efforts in our country. Any question that you may have will be addressed in terms of what status are we now after this outbreak was declared and what happens next. We know that tomorrow the Ministry of Health and the National Public Health Institute will again be addressing the press at another level for another purpose. And we look forward to your presence so that you can take the message and inform our people. All of what the county health officers are doing, all of what these diligent public health practitioners are doing cannot be heard and cannot have its effect if you don't carry the accurate and proper message. Then we will start fighting among each other. No, I didn't say so. No, that's why you said. But who suffers is the common person. We will be debating that instead of writing out something that will ask for some help, but we are writing to respond to misinformation. So we are asking you anything that you don't understand, just call us. We are willing anytime. We are all on Facebook. You can check our personal accounts as well as the official accounts on Facebook, on Twitter, I am on Instagram. We have the NPHIL on LinkedIn. So post your questions there, and you can rest assured we monitor these things very religiously. And those of you who follow me know that you send me an inbox message. If I get to it, I will tell you hi back, because I know we know you take your hard-earned data to just say hi or to say, hey, what status are we now? We are bound to answer those questions for purpose of transparency, openness, and honesty. I will stop this far, and any one of our colleagues who have any other thing to add that I didn't add can add that, and then we'll entertain your questions. So to summarize, we have one active case. That case has been isolated. When I say case, a case of monkeypox infection that fits all clinical criteria for determination. It's been validated by the test that was done in the laboratory. So we have that case, it's active. We are doing all the contact tracing that we can do, and we are managing that case. The good thing about it is monkeypox is manageable. And we're doing everything possible to source vaccines in the country as part of our preventive measures, as we said before during the MICA press conference, and many other things we are trying to do. We're trying to get both vaccines for monkeypox and vaccines for smallpox, because those are the two that are related. And from the science, we know what we can do with those vaccines when we get all of them together. The next thing we're trying to do also is to get a lot of diagnostic kits. During COVID, we ran out of diagnostic kits, and we have all these cases. The only way you see these cases is when you are testing. When you are testing, that's when you see what you have. Instead of living with the illusion that we have zero, but you have the cases just going through the population. So we are sending for more kits through the WHO and our partners, the Africa CDC, the US CDC, AFINET, etc., etc., USAID, and all the other, including GIZ. Then, with our in-house capability that we acquire, we are also going to develop our own kit as well, so that we are able to test while we wait for testing materials to come to us. So those are things that measures that we are putting in place in total in order to address the situation. Thank you.
Thank you, DG. Distinguished colleagues, the DG will now entertain questions, so just call your name and institution and you pose your question. We'll start with you.
Thank you, DG. My name is Strokon Flama and I report for Spoon FA. You said that the case that you are currently monitoring and trying to solve, the person didn't travel from Liberia. Like other countries are currently experiencing this outbreak. Somebody will say, then how come this person, contracted this virus?
Very good question. Let us note that these viruses have existed sometime far before we humans came onto this planet. And they've been around. Their environments have changed, and we only see them sometimes when they have changed themselves over and over and again to adapt to the newer environment since millions and millions of years ago. So that's one factor to that. That even if nobody travel, you can have this virus springing up in an area. The second thing is because the virus is what we call zoonotic virus, meaning it is harbored within animals. So there are squirrels, monkeys, they transmit these viruses from each other. But later on, this virus then sprung from the animal kingdom and came into, let me not say from the animal kingdom, we are also part of the animal kingdom. so it sprung from the lower ladder of the animal kingdom and came to the higher ladder, right, to us, to humans. So that's how it's transmitted, that's one way. Another possibility could be that we have a direct border with the Ivory Coast. When you look at the map, and that's what we're trying to figure out, as disease detectives. We have a direct link. Sino has a direct border with River G. River G has a direct link with the Ivory Coast. So is it possible that somebody may have picked it up from there, traveling through there, they may not have gone to Sino, but somebody else picked it up from that person and transport it there. So that's a possibility. Now, because the virus is self-limited, the person who may have been the first contact, the importer, quote unquote, nothing happened to them yet. The virus keep going from one person to another and ended up with a child. Now look at the statistics. You know, science is so, in a way, accurate because we devote a lot of time to it. Most of the infected patients are children under 15. So with all of what we're seeing, the statistics tells us that the science that is going into understanding this virus is very correct. It's close to accurate. That the first person we detected is a child. We are not saying that across the board will be children. As we know, the mother now became infected because the mother is in very close contact with the child, trying to nurse the child. So this may have been the situation for which we activated the surveillance system along our borders. And we are saying this may have been a possibility because diseases travel.
Yeah. Yes, sir. My name is Edwin Chinowe. I work for Front-Page Africa. You mentioned in your testimony that have issue with the remote area, reaching out to the remote area. So my question has to do with what additional resources are needed to effectively monitor and respond to potential cases in those areas?
For communication, we need elements of communication. That's one. It's very important. If we can have communication, like, we can facilitate communication, maybe cell phone and those things, it will make it easier. Because then the time it will take for anybody to access that area, we have people stationed there already that can send us the information. That's one. We need personal protective equipment, things like gloves, gowns. We had a whole list. Yeah, we need rain gears, like rain boots, because there's a hard terrain to go into a rainy season.
Nose masks.
We need nose masks and a lot of things that are needed, that we use clinically and for epidemiological response.
Yes.
And mind you, we say we need an ambulance also. So I shouldn't forget that one.
Yes.
My name is Tina S. and I'm from the leader of the newspaper. So other countries, including DRC, where the import virus or the import disease has been reported, it has been needed and prepared to site. So when it comes to Liberia, what is our base? We should start doing this to avoid the further spread. Now we have one case to avoid the further spread of import. And again, why you keep saying monkeypox instead of mpox?
When I say monkeypox, because I'm talking about the transmission, so I'm talking about the virus. Mpox is the disease caused by the virus monkeypox. So when we talk about
mpox instead of monkeypox.
yeah, but the context in which I'm speaking is the context of transmission presently. And what we want to detect is not mpox, we want to detect the monkeypox virus. So that's what I keep referring to. Monkeypox. But we can say, once all of that has been established, then the person has what? Mpox. So just to make that distinction, it's a very good question. Now, to what you said, the transmission, yes, it's through personal contact, person-to-person contact, and through sexual contact. We made that very clear during the last MICA press briefing and on radios where we've had the ability, possibility to talk to the nation. It's been established that the virus is also possibly transmitted through sexual contact. We have not declared it scientifically as a sexually transmitted disease, but it is transmitted in that manner. And the statistics also show that it is transmitted mainly by, men who have sex with men. Now, and that portion of the statistics can be found, in the West. In our area, when you talk about the DRC Congo, and we discussed that during this meeting, is with, heterosexual. So, and then they brought into question the prostitutes, So, they further categorize the demographic. So that's the sexual transmission aspect, for which, for the DRC Congo, for that specific case, the whole abstinence or safe sex is a big thing that is being carried out as an awareness in the population.
Yes, it's better than that.
All right, so my name is Blamoto Alukufa, the library investigator. So my first question to you is that do monkeypox and COVID-19 have any, or have some more terrible or less terrible similarities?
Okay.
And secondly, with frequent treatment, how long does it take to leave the system of an individual? So last year I lived in Liberia. 2 days ago, I had a fellow who said he works at redemption, and I've seen it there. And he was telling the citizens in the area that 3 cases have been confirmed in Simple Bridge. So it's where we have been considered a hub.
Of what?
Of the virus talking about a monkeypox. So that's what he said. So I don't know, what question do you also give? Probably.
To start from that point, we are right in Monrovia here. So that kind of situation we will know immediately. In fact, 2 weeks ago when I was on Truth FM, there were calls that came in with people who thought they found themselves suffering from the virus, because of their outward symptoms. Only to know that, and we immediately traced them, took them to the hospital, and it was confirmed that they didn't have it. Instead, they have what we call scabies. That's another thing we can talk about another time. The other lady who called from the Pinsville area, Congo Town area, we told them to go to Kaplan or SOS. There was no confirmation of such. Now, and this is where we talk about, be careful with the terminologies. Now, you as a journalist telling me you saw a confirmed case. Who confirmed it? We as an entity have just told you that we had, in the past, we had those cases, but presently we have 1 confirmed case.
Sir, I did not say I saw. I said an individual who said he works at redemption.
It's the same. I'm just going back. I'm talking about what you were saying. I'm talking about confirmed case. That's where my whole. I'm not saying whether you saw it, he said it, I saw it, but what you are saying that it was a confirmed case, or that person saw a confirmed. So again, we come right back to where we started from. How can you say it was a confirmed case when we are reporting here to you that to date, the far place in Sino, where it's difficult to get across the river, there where we got 8 good samples from. And you think we can't get samples from anywhere in Monrovia here? You probably should have questioned that person where they got their information from. As a journalist, go there. Did you go there to follow up? So also, while we do this, we're very careful with even health workers being infected, because most health workers are being infected because of all of these situations. So we're very careful of that. So you as journalists will also help us. Let me say something. I lecture public health at various universities around the world. And one of the first slides that I show is a tree, or it's a maze. And you see public health in the middle. I'm sorry my computer is not on. If you look at every other thing that springs out of there, it's all of us. It's not only our colleagues, us who went to school and did NPH, Masters of Public Health or Bachelor of Public Health. It's all of us. The politicians are public health practitioners. The military people are public health practitioners. The journalists are public health practitioners. The soldiers are public health practitioners. Medical doctors. Just all of us who live, are public health practitioners. Aside from our people who pass away.
There are 2 questions. The first 2 questions I asked, what are similarities?
The similarity, they are not related. COVID is different. Monkeypox virus is different. COVID too can be self-limited depending on the individual is infected. But the virulence level, when you talk about which one is, dangerous than the other one, the virulence level, what we call virulence, which one is dangerous, they differ also. Now look, this particular virus was detected first detected around 1958, 57, 58. Then it was confirmed in 1970, both in Liberia and in the DRC Congo. The first confirmation that saw it and said, now this is what we are seeing, this is how we name it, and everything is different from smallpox, although they show the same symptoms. Since that time, there have been repeated outbreaks all around. And this is one of the first times that is now going outside, is now becoming what we call pandemic. I'm not saying it's a pandemic. Don't quote me on that. It's becoming, because it's going outside now. It's not just Africa, it's not just Liberia, it's not just DRC Congo. We can see it in Europe, we see it in America. When I was in the States 2 years ago, we had to fight monkeypox virus outbreak, Mpox. Yes, you know. Now, as the first one that was seen was the baseline one, right? Now it start changing your colors. Just like how when you leave from here, every time we say we're going in the cold, right? You go to America, Europe, you got to wear a big jacket during the winter time. You're not going to wear an African nice bazam or things like that. Otherwise, you will die from the cold. So they change themselves to what we call genetic changes, mutation, we call those, okay? They change themselves in order to adapt. So now we have different types, what we call clades. So different types of the virus now. We have 1B, we have 2B, 2A, 2B. We have all those different types now. Now, depending on the type, it may be more dangerous, virulent, right? Or it may not necessarily be, kill you, but it's easier to infect. It's easily transmissible, meaning that it's just going to infect people, but it not necessarily will kill people. Something like that. So there are these different little things that we try to study. All the big book people here, and then we talk to each other, then we take the idea from there, and they say, you go and talk. So these are the kind of little things that happen.
Yes, I'm a costing Mali on a property in New Liberia. Now we have an active case around the southeast. I'm concerned about local traditional healers. What can NPHIL say?
Please repeat.
I'm more concerned about local traditional healers. What can NPHIL say to them in order to limit the spread of this disease?
Yeah. Far before, and I can say this, and I said that at the NICA press briefing again, those of you that were there, far before modern medicine came, our people were confronted with these pox viruses. So they have names for them. In a tradition, things that have been confronting, our people, they already gave them names before the Europeans, colonizers came. So in the southeast, for example, among the Gravos and the crew, there's pox, smallpox or whatever it may be, chicken pox, they call it puan. And you will hear different names in different places. So they had a name long before the Europeans came in that place. And so they have been treating it their own way, all right? What we're saying now is the way they were treating it during those little outbreaks then was not informed by what we call modern science. They knew their own ways of treating it, which worked or may not have worked. What we are saying in this modern time is we have the ability now to know what the virus is. We have special medicine to just give to kill the virus, what we call antivirals, right? To give somebody and kill the virus and heal the person. Then we are advising them, if you see such thing, don't start rubbing all the herbs and the chalk on the person. Please take them to the nearest medical facility. In the future, what the NPHIL would like to do, and that is in our program, is to begin to incorporate the scientific study of these traditional medicines, all right? To see what's in there, what is that chemical component that is active, an ingredient that can be used for medicinal purpose. So we do intend to do that.
Yes.
Yeah, my name is Raf, and I report from Vision Television. After they discovered the outbreak of the monkeypox in Liberia, the public out there are a little bit feared. So they want to know what can they do to prevent the issue of this virus.
Vision Television. you are the news outlet that put out that information that you didn't contact us. We were very disappointed. Don't do that to us next time. Look, we are open. And you can just drive out here and come and talk to anybody. We have a lot of epidemiologists in the division we call, infectious disease and epidemiology division. You can come and talk to anybody here. It's your taxes that are paying us, so we are responsible for answering you. Anyway, I think you can answer that question.
So, basically, in terms of prevention, we would like to firstly drill us through the mode of transmission, okay? Because in order to prevent something, you should know how it is spread. And you did hear from Dr. Nyan that it's spread through person-to-person contact. So, in terms of prevention, we acknowledge the public, to adhere to the public health advice to prevent touching sick persons, okay? So if you have anyone who's presenting with fever and symptoms that are characteristic of monkeypox, you are advised to avoid from treating that person at home and taking that person to the nearest health facility for treatment. The prevention is similar to what we did with Ebola. Some of you may have been around with the Ebola epidemic. To avoid touching sick persons, to wash your hands, avoid playing with animals like monkeys that may potentially carry the virus. Just ensuring that you adhere to good personal hygiene and preventive measures. We also heard about the disease potentially being transmitted through sexual contact. So it's also to avoid getting involved in high-risk sexual behavior, okay?
You men, wear your condom. Let's just say it out clearly. High risk. There's no way to sugarcoat certain things. These things are available. Buy them and wear them. Stop, you don't know what you have.
Okay,
yeah, my name is Bill and I write for Inquiry newspaper. I'm just a little bit concerned in terms of strengthening our sorting when it comes to traffic, locally and regionally. Where are we? Now we have registered one case. I believe in the coming days we'll see, we'll hear about maybe additional cases now that you are doing contact tracing. Where are we in terms of strengthening our border system with our regional pilot? I know people did thousands of cases, I know hundreds of cases, and regionally now we're talking about Sando. What happens to the other neighbors of distinct counties?
Yeah, so thank you very much. So the team has, nationally surveillance has been heightened at the POEs. Right now we are ensuring that we have surveillance heightened at these POEs. Also, through the Africa CDC, a continental IMS has been set up, and that IMS is also supporting coordination with African countries. So that is critical for coordinating between Liberia and other countries that are even within the sub-region. Also, specifically in Sando County, where we have a new confirmed case, the county health team, the entire surveillance team there are reaching out to the various contacts of that case, but then they are going beyond the initial districts because of the potential to spread to other districts. So they are trying to reach out to other districts to see what is happening, to also communicate to these people good hygiene practices, to effect RCC practices, risk communication, community engagement, to improve on all of these things, to ensure that we minimize the spread of the infection beyond the original point. So both locally and then both regionally, we are doing our very best to ensure that we're able to contain the situation.
Yes.
Yeah, my name is Steve Rodriguez, and I work for Cardigan with Steve newspaper. If I got it correctly, you said the role of transportation is
Transmission.
Transport is yes. So you have to get it after that, they take it to this next area, you get over back, and then before you get here, So what are the mechanisms put in place to Will it build an isolation center in those various places that in time to come will have this virus or this virus?
Well,
Building isolation centers, we need to understand in terms of the resources, not only our money, but also our people resources. So obviously, it's almost impossible to build isolation center in every community. So we have to build isolation center where we have health facilities that have the capacity, both in terms of human and other resources to manage the business.
So remember that the INET has been activated, so we are at work. So we get entertain the last 3 questions, please.
Yes, my name is Sanga and I report for the Sir, I hear you talking about a confirmed case, yes, suspected cases, and if so, how many?
Yes. When we started off, we said there are 8 suspected cases. Out of that 8, we have tested the samples of 2 that we got, and all samples are on the way. And of those 2, 1 came up positive, which is our first positive confirmed case. So those other cases, they are under surveillance. They've been monitored. The samples will come. We'll have them tested, and then the results will inform us as to what their status are.
So, if I may just add, so it's important to state that the suspected cases are also in isolation.
Right.
So those cases that are suspected are not out and free. Those cases that are suspected are in isolation, including the 1 positive case that was confirmed. And then the contacts of these suspected cases are being traced so that we're able to know all those that we need to test so as to minimize the spread.
Yes, thank you.
Yeah, thank you, sir. Lincoln H. Valley, I represent Analyst newspaper. Yes, it's been established that Liberia has 1 active case, right, for monkeypox. So we here to know how this patient responded, and also in addition, how long it takes once one is going through the proper treatment. How long will it take for the sickness to continue or to be cured?
Yeah. So coming to the last question. So the recovery period is based on the patient's immune system. Some people will recover very early. Some people will. It depends on your immune status. If you have underlying condition, it will take longer time to recover. But at the end of the day, I mean, it's manageable and sometimes you recover faster based on your system as you recording.
Okay. So in terms of the patient's status, currently the patient is clinically stable and safe to be recovering. You should note also that as part of the information that the DG has shared with you out of today or in previous press briefings, as a country, one of the cases that were reported since the beginning of this year, we have had no fatalities.
No fatality,
No death.
Nobody
not that.
Nobody not that.
Everybody's still living.
Okay, I wanted to add one last thing. So I think one last thing, I think the DG weighed on that. I think that was the first question. So I think we're also trying to probe and understand further the source of that infection. I think the DG explained that there are multiple means through which it could have come about, but we also want to do something we call genomic sequencing. We are working with one of our technical partners to provide that support so that we are able to sequence the virus. What we want to do is just basically understand the strains that we have here. I think he has mentioned that there are different strains, A1, A1B. So we want to know the strain, and then we'll also be able to determine the source. We know originally where it could have possibly come from. So all of those processes are in place. We have started with discussions while we move out fully in terms of responding.
Okay, so distinguished ladies and gentlemen of the media, so thank you for responding to our call. Again, we have to emphasize that the DG says As you go back to your newsroom, in the writing of the news script, if you do not understand anything, please call for clarification. We beg you. The Director General again is the official spokesperson of the National Public Health Institute of Liberia. And as media practitioner, it's always good to get your soul from an authoritative soul. And the Director General is the authoritative soul. He will be the official spokesperson. Anything you want, call the Director General and he will let you know. We also like to recognize Mr. Lawrence Famule, the Director of Public Affairs and the Ministry of Information and Cultural Affairs. So thank you for coming, Mr. Famule. So this note, first number is just now over. Thank you.
Thank you so much.
Focus on Liberia, the National Public Health Institute of Liberia, and the doctor of the head of this institution is giving us an update of the virus as the mpox in Liberia. My name is Gwendolyn Dorado. I said thanks for watching.